My name's Candler Matthews. I'm from Sumter, South Carolina. I grew up and played sports growing up. Loved watching Sports Center and things like that, and played all the sports year round. Went to Carolina for college and med school here in Columbia, and then I went to Arkansas for my orthopedic surgery residency. And then I went to Vanderbilt last year for my sports medicine and shoulder surgery fellowship, and had a great time taking care of lots of teams, including the Commodores, but also the Nashville Predators, the AAA baseball team for the Brewers, the Nashville SC MLS team, and of course high school football there. And I also did that when I was in Arkansas. So the rotator cuff is 4 muscles on the shoulder. You have 2 up top, and then you have 1 in the front, 1 in the back. Basically, their job is to hold the humerus or the ball in the socket kind of in place. So our shoulder has the most motion of any joint, and so the rotator cuff helps support that and keep it stable, while also allowing us to do functions like reaching overhead and other little kind of fine motor things like that. Sports medicine fellowship, we do minimally invasive surgery, so like shoulder arthroscopy, but it's not, and that's basically doing a small camera and small poke hole incisions. And we treat things like rotator cuff tears, and most commonly we actually treat it in non-athletes, just people who are active, so not necessarily a professional athlete. As we all age, we do develop rotator cuff tears. There's studies where they MRI a whole village, and about 50% of people over the age of 70 will have a rotator cuff tear, but not all those need surgery. So there's times where you have a traumatic rotator cuff tear, where maybe the shoulder pops out of socket, and the muscles rip off the bone. Those typically do need surgery, but then the atraumatic, or the ones that just develop as we all age, kind of like an old pair of jeans, are ones that a lot of times we can treat without surgery. Here, patients who have rotator cuff tears come into our clinic. Things they frequently complain of is night pain. So you have trouble sleeping at night because you never feel comfortable. A lot of times that actually helps to sleep in a recliner or something like that, or a lot of pillows to help prop you up. Other things that are common for when they may have a rotator cuff tear is anything pain overhead, like reaching overhead, getting things off of a shelf, particularly trying to get something like a milk jug out of a fridge. They just feel like they drop it, or they can't support something that weighs a fair amount away from their body. Particularly if it's a traumatic rotator cuff tear, you're young, or even if you're older, and you have an injury to your shoulder, you're worried about it, you can't lift your arm, come in and see one of us as soon as you can. And we want to get an MRI of that and look at that and make sure if it is a rotator cuff tear that we get it repaired quickly before it has time where the muscle atrophies, or basically it gets smaller because it's not being used as much. MOON stands for Multi-Center Orthopedic Outcomes Network. Vanderbilt, along with several other thought leaders in shoulder surgery world, all basically put their collected data on their patients and now have over 10 years of data. And they initially met as a group in the early 2000s and decided on this rehab protocol. So these are shoulder experts that decided on the rehab protocol. They tested the protocol, and they have great results showing what this protocol does and helps treat people without surgery. So you have the benefits of shoulder experts from all over the world collaborating on this protocol, and we have the results to back up that it works. Wake up in a sling. We want to make sure that tendon we put down onto the bone heals, and we want to give that about 4 to 6 weeks for it to heal. So really not a lot early on. We want to make sure that tendon heals the bone. We let you come out of the sling and work on a little bit of motion, a little bit of what we call pendulum exercises, or kind of swinging your shoulder back and forth. But in general, after that, you start getting your motion back slowly with a therapist for about a month, and then over the next month or two, once you have full motion, you start working on your strengthening. So I'd say around that 3 to 6 month ballpark is where people start to not have as many restrictions, and you can still see progress for up to a year. What can prevent rotator cuff tear injuries, I would say in general, is strengthening your scapula. You have 17 muscles that attach to your scapula. One of my mentors, and again, Jed Kuhn, that started the MOON protocol, said the scapula is kind of like the feet of a crane, and our arm is kind of like the arm of a crane. And so the stronger that feet is secured to the ground, the more weight that arm can support. So particularly with all of our jobs in America, our shoulders kind of roll to the front, and that's called scapular protraction. It's a fancy doctor term to say not great posture. But then when we bring our shoulders back and they're retracted, kind of trying to pinch your shoulder blades together, That's the motion that you can work on with therapy that can eventually help prevent some of these impingement or even rotator cuff tears. Call us up. We can get you in same day or at least that week. Happy to see you. Let us evaluate you. You don't have to go through the, don't feel like you have to go get an MRI or some fancy study or do a bunch of things before you see me. I'm happy to see you and evaluate you myself or our team and us decide if you need that MRI or not, or there's a lot of things we can treat without having to spend a bunch of money on these studies. I'm actually at our Northeast Hospital. I am in Elgin, so you can call our number and get an appointment with me. You can also book online at muschealth.com. I've got a page, and soon I'll have my own personal page actually as well, and I'll be able to help route you there.